Hey everyone, it's Jennifer. What is today's date? November 7th, 2015. I have not been here in a long time, but I'm making a video today because I'm about 6 days out from having my reconstructive plastic surgery. I'm having my tummy tuck done and my arm lift done at the same time. I am his only patient that day, and the surgery is about 8 hours long, so I'll be under anesthesia for about 8 hours. Recovery is about 6 weeks. They still have about 6 drainage tubes. Those will come out about week like 2 or 3. So I have 6 weeks recovery. I'm taking 4 weeks off of work, and about 3 weeks off of taking care of my niece. I've had this surgery like rescheduled like 4 times. The first 2 times was because of scheduling conflicts with school, but I'm not in school anymore, so that doesn't matter. And then the 3rd time was because I failed my respiratory test during my medical clearance. So I ended up having to go to a specialist and having it done, and they were like, you're completely fine. So I had to reschedule, and because I've had so many problems with this, and I just have a jacked up sense of humor sometimes, I chose the date Friday the 13th. So my surgery is on Friday the 13th. Normally I don't wear a tank top. I'm wearing this today so I can show you my arms and stuff, like a pre-op picture kind of. I'm not going to show the stomach on camera because YouTube is forever, and my boss can watch this, my family can see this, and if something happens and I can't have surgery, I'm going to be completely embarrassed. So I will take pre-op pictures, and when I make my post-op video, I'll include side by side so you can see the difference. Today I'm just going to show you the arms and maybe like the outline under my shirt. But at any rate, so Friday the 13th is my surgery. I'm going to try to make this video as short as I can, but I do have a lot to kind of update with in terms of weight gain, in terms of having the plastic surgery, in terms of 2 other videos that I really want to share with you. One is from Kelly Fat to Fab, I believe her name is. I'm going to put the links to their videos in my description box below the video, so you could just click on the links and watch their videos. And the other one is from somebody named Patrick, who I actually met through a food addict after bariatric surgery group page on Facebook or whatever. So at any rate, so I've been exposed to these videos. I think they're really good information, and I think I want to share them with you only because I see so many people struggling, especially when they're 2 or 3 years post-op or beyond. When you start gaining a couple pounds back, or when you feel like everyone around you can follow the rules, why can't I? Like all that nonsense that people throw around. I just think those videos have very good messages, and I want to share them with you. And I also have 2 books that I want to share with you. So let me do the weight gain part first. I have gained I had my original bypass in March of 2012. My heaviest recorded weight was 323. I stopped weighing myself after 323, so I was probably bigger than that, but was 323. The day of my surgery, I was 301. I got down to about 210. Then I started to gain weight, and when I got to 220, I'm like, this is it. And I told my surgeon I have absolutely no restriction, blah. So he did the swallow test, saw that I did not have any restriction, and suggested that we do a bypass revision, which is really all they do. They don't touch your stomach. They just make the stoma smaller, tighter. And that's what they did. But they made it too tight. And so I wasn't really able to eat. I wasn't really able to drink a whole lot. So within the first month, about 6 to 8 weeks after my surgery, I was down to 195, which I was like, oh my God, I'm in Wonderland. And I didn't think that I would be one of those people who would care about being in Wonderland. But shocker, I was. But since then, I weighed myself yesterday. I was 232. So I am like 100 pounds less than I was when I started this whole journey, but I have gained about 35 pounds since I had my revision, since I was able to eat again. I have not been super stressed about it, but it has worried me a lot. And I have seen a couple doctors about it, and I've gotten some interesting responses. My plastic surgeon, actually this last time when I went in for the consultation for this surgery, was concerned that my weight had gone up, because when I first saw him in January, my weight was 212. So that means in 10 months, I have gained 20 pounds. So that's like 2 pounds a month. Obviously, do math. And that's kind of crazy. I know it's probably because of the frozen Cokes, because I'm still obsessed with frozen Cokes. I have 2 or 3 of them a day. It's so not good. I know it's not good. I don't know why I don't stop, other than it just feels good to drink them, and I like them, and I don't stop. I don't know. But I don't think it's all because of my eating habits, because I don't eat that many calories. I don't consume that many calories. I still have a lot of restriction since my revision in June 2014. I think I forgot to say that. So I still have a lot of restriction. I know my PCOS plays a role in some of it. But I'm on all kinds of medications now for my allergies, for my PCOS, for my bipolar. So yes, in some ways, I'm a lot healthier because of my bypass, but please do not think that if you're a newbie and you're going to have weight loss surgery that, you're going to have it and you're going to be off all your medications and life is just going to be so wonderful and happy. It is not the way it is. I am on, my PCOS got worse, my bipolar depression got worse, and my allergies got worse after surgery. And all those things I was told were going to be magically cured after surgery. No, they got worse for me. Some people, they do get better. Maybe they'll get better for you. They did not for me. So I'm on metformin now for my PCOS. Usually people who take metformin have diabetes. I take it because I'm now insulin resistant. I kind of crossed that threshold after I lost 100 pounds. Go figure. I don't really have to take a multivitamin or anything like that, because I get my blood work done every 3 to 6 months because of all the issues I have, and I'm never nutrient deficient in anything, which I don't understand, but I'm not. I do sometimes take a B12 only because the metformin can cause you to have a B12 deficiency, so I take a B12. I take Zyrtec every day. I take Flonase every day. I take my Advar every day. Those are for my allergies and asthma. I take my Lamictal for my bipolar. I take Sparlactone, I think I'm saying that right, for my PCOS. So I take a lot of medicine. From the time I wake up to the time I go to bed, I have about 4 different times of the day where I have to take some kind of pill. I also have to take now a probiotic in the morning, which is part of the weight loss thing I'll tell you about. So at any rate, so my surgeon was concerned. He really didn't want to do the plastic surgery because he wants people to be stable in their weight. And the fact that I've continuously gained weight, he was very concerned about that, because not so much that I'm gaining weight and it will look bad, but when you've had plastic surgery and then you gain the weight back, as adults, as you're growing through your puberty stage and you get to be an adult, you only have so many fat cells in your body. So when you're gaining weight, all you're doing is those fat cells are expanding. When you have plastic surgery, those fat cells are removed from your body, and you don't regrow new fat cells. So if you were to gain weight after plastic surgery, those cells that you have left will swell up, but more than likely, not more than likely, for sure, that weight is going to go to other areas where you still have a lot of fat cells and they're going to expand. So for me, I'm having a tummy tuck and arm lift. If I were to gain weight after this, all my weight, all my fat would go to my thighs and my hips and my butt. All of it. Then I'm going to be extremely disproportionate. It's just not a good scenario. So obviously he doesn't want you to gain weight. Plus, whatever he tightens will become flabby, and you're kind of wasting a surgery, and it's not cheap. I had to finance all of this. My insurance does cover the tummy tuck portion, but it does not cover any of the other stuff. And I'm sure there are some medical reasons to have surgery, have plastic surgery, but 99.9% of people who are having plastic surgery after weight loss surgery are doing it for cosmetic reasons. And this is totally a vanity thing for me. I lost 100 pounds. I'm awesome. Or, I lost 125 and whatever. But I really don't feel confident. I really don't feel like when I put clothes on, like at work, I love my job and I love the people I work with. They're amazing people. I really consider them friends, but I work with all guys, and it is very common for me to hear comments about women's looks and this woman is this. And I feel very uncomfortable at work. Not because they make me feel uncomfortable, but because I have issues with my own body. And so I take their words about other people and I project them onto myself. And so I wear a sweat jacket every single day to work. And I keep it zipped up to about here, so that it covers my stomach and it covers my arms. And I can wear jeans and t-shirts to work, but I still wear that sweat jacket because I don't want my body to show. I cover up as much of it as I can. And that's just in my head ridiculous. And I know that. And people at my job would be like, Jennifer, that's stupid. You don't have to do that. But I feel like I do because I care about what other people think. Segue into the next doctor. My plastic surgeon was extremely kind, sat with me for a long time, talked to me for a long time. And I really appreciated the time that he took to sit and talk with me about the weight gain and how it will be distributed and, you know, what I have to do. I really did appreciate it. My endocrinologist, God love him, like, I'm sitting in his office and I'm like, I'm here because I'm gaining weight and I need to know what to do to stop. And he was just like, look, if you're gaining weight, it's because you're eating too many calories or you're consuming too many calories. So this is what you have to do, point blank, the end of the story. Reduce your calories to 1,000 a day. Do not eat less than 1,000 because then you will start having nutrition deficiencies. Your energy will go down. You'll start to have health problems. So 1,000 calories a day, that will put you back into losing. Once you get to the weight you want, it's between 1,000 and 1,200 a day. But 1,000 calories a day, you take a probiotic in the morning because that helps with your gut stuff. You take your metformin like you're supposed to, you will be fine. And he said, my real issue that I'm going to talk to you about is not so much your weight, but it's your mentality and your emotional reactions to your weight. He said, you really do need to sit down and talk to somebody about this that you trust. Maybe not a counselor, but people in your life, because all I hear from you is that you are letting the world tell you who you are. And it shouldn't be that way. You should be telling the world who you are. That should be your decision, not people projecting onto you whether you're a good person, whether you're attractive, whether you feel comfortable in your body, whether you should have a right to feel comfortable in your body. And he's like, you've gained some weight. That's true. But you have not gained so much weight that I would consider you to be a failure. He's like, you know, your health, you are still in good health. You know, you have some medical issues, but they're not detrimental to your satisfaction of your life. Can you still tie your shoes? Can you still go to the bathroom by yourself and take care of yourself? Can you still shower by yourself? Can you buy clothes? You know, can you do all the, and you have to focus on the quality of your life and the way that you're able to take care of yourself. And that is success. Success is not a number on a scale. It is not the size of your clothes. It's like you need to focus on, stop letting other people define you, find that happiness within you. And, you know, he's like, you're beautiful, you're healthy, go with that. Like, stop worrying so much about your weight because you're making yourself stress out about an issue that isn't an issue. And this is coming from a doctor. And a male doctor at that. So, I don't know. I really, really needed it. And the weight gain, I was trying to think, like, was there anything that kind of started the weight gain? And I don't know. Like, I was in a relationship with somebody for a while, and he's, you know, a cook and he was a chef and loved to cook and do all that stuff. So food was always an issue. And I'd always tell him, like, you know, I'm a food addict. And, well, not so much a food addict, but I have food addiction tendencies, I guess. And I definitely have an eating disorder, several eating disorders. So I already knew right then that that wasn't cool. But everything that we did kind of revolved around food. And he, you know, I was enticed by the relationship because I felt like, oh, he spoils me. He does all this nice stuff for me and blah, blah, blah. When things started to get comfortable, though, on top of everything revolving around food, then it was, once he was comfortable and, like, it was like 5-6 months in, or 4 or 5 months in, then there was little comments about, why do you wear so much makeup? You know, which I would wear this amount of makeup. I don't think this is an exceeding a bit amount of makeup. I mean, I think this is good. But he would make comments about, why are you wearing so much makeup? You know, just comments about my issues and why are the issues, and how they were more of a burden than something he really wanted to be supportive about, or just like when I needed him to be there, he wasn't there. And when I'm a very like needy person, I need a lot of attention, and I give it back, but I need it. And once he got comfortable, the honeymoon phase wore off, and then I thought things were good. Long story short, I thought things were good. I come back from vacation, he found somebody else on Tinder. Yeah, because everybody finds love on Tinder. Now he's with somebody else, and all the things that he's saying about those girls, he said about me in the beginning. So it's kind of weird to look, because I still talk to him once in a great while. Not very often. But it's interesting now to hear him talk about them, and they're so much like me. And to see it now from an outside point of view, I can see now, like, that was not a healthy relationship. I'm not saying he was a bad person. He's not a bad person, but that was not a healthy relationship. And because I take from the world and I make that who I am, I took a lot of his comments and insults and took them personally and made them who I was. And so I gained a lot of weight from there. And now the summer came, and then I just kind of gave up and was doing all the frozen Cokes, massive frozen Cokes, and I stopped exercising, and I stopped going for walks. So I've gained all the weight. So, 30 pounds 3 years out isn't like a major red flag, but it is something to pay attention to. So with plastic surgery, I'll obviously lose weight. During the recovery stage, I'll lose weight because you don't really want to feel like eating or whatever. Sorry. This is tea, by the way. This is not a frozen Coke. It's tea. It's good. Decaffeinated tea. At that. It's decaffeinated. So I just need to get back on track. But I'm going to get back on track my way. And those 2 videos that I'm going to post below, that's kind of what has made me realize what I have to do. I'm so sorry this is at 16 minutes. See what else. Doctor visits, weight gain. I wrote everything down because I have too much to talk about. Let me just talk about these 2 books real quick. They've been very, very helpful if you're pre-op or you're post-op, whether you've been successful or you feel like a failure. You have to read these books. And I'm telling you right now, you have to read these books. These books should be assigned to everybody when they have surgery. Like when they're going through the consult, they should have to read them. And then after they start to have weight loss, they should have to read them again. So the first one was called It Was Me All Along. It's by Andy Mitchell. She did not have weight loss surgery, but she was an obese child. It's a memoir. It's not really like a how-to book. It's just kind of her story. I got this on Amazon. I got both these books on Amazon. Her story is very, very interesting because it talks about how she learned to love food, how she was obese, what was going on in her life, what moment changed her to start losing weight, then how that kind of spiraled to her having an eating disorder, and now she's at a healthy weight and she's happy, and she wrote a book. The next one, I love, 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 love this book. Please buy this book. If you hate to read, buy this book. Okay. It's called The Emotional First Aid Kit. The fine print, if you can see it there, says A Practical Guide to Life After Bariatric Surgery. As you can see, I also had my nails removed because I can't have them during surgery. See, I'm worried about my looks all the time. Anyway, The Emotional First Aid Kit is by Cynthia Alexander. Got it on Amazon. This was really cheap. It's kind of a thick little book, but man, does this cover everything. I mean, everything. And everything you're thinking that you think no one's going to understand, that nobody else is going through that. For real, buy the book. There's so many times I've read this book and I've been like, oh my God, I didn't know anybody else was going through that. And B, I didn't think of it like that. I have not even finished this book yet, and I'm going to reread it again after my plastic surgery because I'm going to memorize this stupid book. I love this book. So there you go. Buy those books. They're not paying me to say that either. I just really love the books. Real quick, actually, I am almost done. So let me do real quick what I bought for surgery, only because I've watched so many videos about other people's pre-op videos and what they've bought and what they needed. I don't know that I'll need all this stuff, but I'm going to show you just in case you do. So, I don't even know where to start. I guess I'll just start here. All right. I bought vinyl gloves, hand gloves, because I don't want anyone, I don't know how gross it's going to be. There's going to be, I think you said 6 or 8 drainage ports. I don't want myself or Noah to touch it if any of the drain sites or any of the incisions with bare hands. I don't, like if I'm taking a shower, obviously I will, but vinyl gloves. Everything I got here, I either got off eBay or Amazon. eBay was really great because everything's so cheap, but whatever. So it's that. I did not get these off eBay. Some of the stuff I kept from my back surgery that I had in 2010 because I always knew I wasn't done with surgeries. I just knew I wasn't. So these are tea drain sponges, which are actually really good. If you don't know, they're about this size, like right here. But they have little incisions like in them, so they go around your drain port. Like your port will go here, and the rest of the sponge kind of goes around it. I don't know how to explain it, but I have several of these, which I'm glad, and I'm so glad I kept these. These will come in very handy, I'm sure. So they're just like the gauze pads that go around it. Speaking of gauze, this is just one package. There's 200 in here. I have about 3 packs of these because I have to shower every single day. Starting the day I come home from surgery. I'm in the hospital 2 days. I have to keep the incisions clean, so I have to take a shower every single day. So lots and lots of gauze. Now the tape, I also brought rolled gauze because that gauze is probably, those gauze pads, the big ones, these I bought for my arms because they're, smaller in size. So, and then I have cloth tape from my back surgery, and then I bought a bunch of paper tape. I bought a whole box of paper tape because I figure I'm going to have to change it every single day, at least once or twice. I cannot remember if I had to have cloth tape because my skin reacted negatively to the paper tape, or if I just felt more comfortable with cloth tape, or if it was an accident and I just bought it. I don't remember, but I have a feeling I'm going to learn the hard way. But I have both, so I can figure out what I'm going to use. Jesus, okay. This is the soap that they give you to wash up before surgery. So I got one for my abdomen, one for my arms. I actually have 4 of these. These are from the 3rd time I went for my consult. But these are from the hospital. So these I have to use, wash up each area for 5 minutes before the morning of surgery. They have to be surgery 6 o'clock. This is just like stretchy to go around the abdomen to hold the, I'm going to have, they give you, the thing. They give you the garment, this garment you have to wear. But if I want to hold everything in place even tighter, I'm going to at least have this. So in saying that, I also bought off eBay a whole bunch more of it. Yay, and in pretty cute little fun colors. These are more or less for my arms because I think these are going to be too small for my abdomen areas, but maybe they would work. But these are the self-sticky kind, so it's that. Then I have abdominal pads with wet-proof barrier. So these you can actually take a shower with, but my surgeon wants me cleaning the areas, so whatever. I have these tiny little cups. I'm so glad I kept this stuff from my back surgery. Tiny little cups, because if I have to be on liquid medicine, then I'll have these in case. These are going to be my lifesavers, because these are the cups for, where am I going? All the way. Okay. That you empty your drains into, and you have to measure, how much fluid you have from your drains. I'm very happy that I kept those, because the drainage stuff is gross. And I don't want to put them in, like, normal cups, so at least I have medical stuff. I bought these nifty little, when you're in the hospital or you're old and you have accidents, these little bed pads or whatever, because I don't know how much blood I'm going to have. I remember from my back surgery, but my back surgery I had a lot of drainage. Most of that was because they did not put enough sutures in, so I was draining because I didn't have enough. They didn't suture me enough. This doctor I don't think will make that mistake, and he knows about that now, so I think he'll be good. But just in case, I'd rather have these on the bed than to ruin sheets and mattresses and stuff. I may not even use them, and if I don't, I'll donate them somewhere, but I have those. I'll show you that last. This little thing, my little handy, which by the way, this little handy caddy I got from Carla. I will put her YouTube channel, a link to her underneath as well. She's actually my friend. I met her because she had weight loss surgery, but she sells these, and they come in very handy. So they're from 31. So she sells it. So if you want any, go see Carla. Tell her Jennifer sent you. But anyway, so these are to clean the incision sites, you know, if I want in between bath, showers, whatever. Not baths, showers. Somebody made a video saying that these came in very handy, these little wisp things, because she couldn't bend over to brush her teeth. She sounded like she stayed in bed a lot more than my surgeon wants me to. My surgeon wants me up and making my own food and getting my own medicine and walking around the house. I'm not supposed to walk up and down the stairs. I'm not supposed to go outside. I'm not supposed to do errands around the house or chores around the house, but he wants me up walking, doing stuff for myself. So I probably will have to brush my own teeth and have to figure it out. But just in case, I bought these. I have 2 of these. Those are more expensive than I thought they were. Then, of course, I have my multivitamins and stuff just in case, because after surgery you do lose vitamins. I bought some dry shampoo, which the light is horrible in here. I don't know that I'll use this. I don't like dry shampoo. I bought it because I thought I'm going to be immobilized and I'm going to have to stay in bed and my hair is going to be gross. And that's not going to be an issue now because I have to take a shower every day. But just in case, whatever, dry shampoo. If I don't use that, I don't know what I'm going to do with it. Maybe take it back. Febreze for the room, because somebody else had made a video and said that even though, you know, they had done their surgery out of state, so they had to stay in a hotel room, and they said just being in the room the whole time kind of made it not so fresh. So I bought this just for the room because I love lilac smells. I think it's pretty. Who cares? So I bought this just in case, and if I don't use it, I can still use it around the house. Not a big deal. I think that's all that's in there. And my B12 is in there, which they're chewable B12. I got these off Amazon. They're really, really cheap, and they don't have a taste to them. That's why I like them. What else? I bought 6 pillows because when I'm sleeping, I have to have 6 underneath me, my head and shoulders, or 3 underneath my head and shoulders, 3 underneath my legs, because I'm going to be hunched over for about 2 weeks. They said I'm not going to be able to lay straight. I don't have a recliner, so I can't lay in a recliner to sleep. So pillows. I was also told that I'm going to have back pains because I'm hunched over for so long. So if you have the surgery and you're like wondering like, why is my back hurt all of a sudden, that's why. I'm sure you'd figure it out though. I also bought this nifty little pillow thing here to put in the back of my chairs or whatever when I'm sitting, or if I have to use it in my bed, I can use it in my bed. What else? Real quick, I'll do a body shot kind of thing, and then I'm going to talk about the surgery real quick. Not very much longer because I'm already at 30 minutes. So I'm just going to show you my arms first. This is why I'm having the arm surgery. Can you see? Can you not see? I'll do this. All of this right here is excess skin. All of it. It's like gross. So they're going to remove this. So I think he showed me it's going to end up being more like that. So I will still have a little bit, as you can see, but it's not that. See the difference? Okay. My incision is actually going from the armpit this way. So I am going to have and it's going to like, I think he said it fades like right underneath the elbow. So that's, it goes like this. So I will have a scar. When I lift up my arm or whatever, I'm going to have a scar. I don't care. I would rather have a scar than this. This is why I don't wear tank tops. I'm excited to be able to wear tank tops. Now the stomach, I battled with whether I wanted to do a body shot or not, because I really do like it when people have body shots in their pre-op videos and then whatever, but I just don't feel comfortable doing it. So I'm going to take a picture, and then I'll take a post-op picture, and I'll put them side by side in an upcoming video. But I'll show you some, but not just, no. So as you can see, it's right here. This is my shape. Okay, so my arms will be different. Pull this back so you can kind of tell a bit more. All of this will be gone. It will not. Yeah, it'll be gone. It'll be flat. And then I'm not going to do too much of this, but I'll do a little bit. And then all of this, which goes down to here, so like all of this, from here to about here, and all the way around to here, will be gone. It will all be flat. Some of that is obviously fat. A lot of it is excess skin. I, for a long time, didn't believe that any of it was excess skin because A, I'm so used to being morbidly obese, and two, I've seen other people's excess skin, and when they've lost a bunch of weight and they're kind of skinny, and then they just have the skin that's flabby there. If I showed it to you, you would see that there is a lot of flab there. A lot of it you can tell it's excess skin, but it really hit home with me. I finally took a shower or a bath. Like, normally I only take showers, and I took a bath, and I was in the bathtub, and my skin, it was the weirdest, freakiest thing ever. If you've never taken a bath after you've had bariatric surgery, like a year out, take a bath. Because it will show you right there where you have excess skin. Because it just floats. It's like, your body doesn't float. Like, it's the strangest freaking thing. I can't explain it to you. But right then when I was like, holy crap, that's weird that my body does that. And two, that's gross. I want it off. So this surgery will really, really help me a lot with my confidence. I'm not scared. Noah thinks it's insane that I'm not scared. I'm not scared. I am worried about being under anesthesia that long. It's an 8-hour surgery. Last time I was under anesthesia that long was my back surgery, and that was 5 years ago, and I have since had 4 other surgeries. Every time I wake up from surgery, my blood pressure is really low, but I've been told that bariatric surgery patients always have low blood pressure, but they are at least aware of the issue. But I am worried about being under anesthesia that long. I do know the risks involved with surgery, and it has occurred to me on more than one occasion, like, please don't let me die from this surgery, because this is the worst one to die from, because it's such a vain surgery. Like, it's not a necessity. I could live the rest of my life with this body, and I would eventually, hopefully, be fine. But confidence-wise, I really need it gone. Like, I'm putting so much, excuse the pun, so much weight into the surgery. I just feel like I really, really need it for me. But that would be the worst. That would be the worst surgery. If I was going to die from a surgery, this would be the worst surgery to die from. And I'm really not ready to die. I kind of love my life. So, anyway, before I start crying in this video too. So I'm worried about the anesthesia. But more than anything, I'm worried about how bad the recovery is going to be. Some people who've had the surgery, they're like, oh, you're going to be in the worst physical pain for a week or 2 weeks. And then other people are like, yeah, I had the surgery. And then 2 days later, I was up walking around the house like nothing ever happened. And I was in discomfort, but I wasn't really in pain. The doctor that I talked to for my medical clearance said the more you have removed, the more pain you're going to be in. You see how much I'm getting removed. My doctor said it's probably between 10 and 13 pounds of excess skin that he's taking off from all areas. So that's a lot. A lot. I hope I actually get to see it. I know that sounds weird, but after I have my surgery and I'm in recovery, I want them to show me what they've taken off. And this is why. I'm a little bit sad about having the surgery. It's sad doesn't normally come with the surgery, I don't think, but I am a little bit sad because this has been the shape of my body since I was a kid, like a little kid. I've always had the 2-level stomach. I've always had curves, but the curves have had fat over it, so it's like curvy. But I'm a naturally curvy person. And I'm used to this body, and I'm used to how to react in this body. I'm used to how to function in this body. I'm used to the attention I do or do not get because of this body. I know how to be me in this body. Once it's all removed, I'm a new person. Just like when you have bariatric surgery and you lose all the weight, you're still the same person inside, but you start to change. And you start to change because new opportunities open up for you, people start treating you differently, you start seeing yourself differently, life changes. Life is going to change again after the surgery, and I don't want it to be for the negative. I don't want to become that egotistical, I don't think I ever will. I don't think I'm a pretty humble person, but I don't want to be that vain bitch who thinks she's the shit all the time. I don't even think that's possible, but I don't want to be that girl, and I have finally reached the point where I don't care about male attention anymore. Especially now that I'm in a caring, loving, real relationship. I don't care about attention from other people, but I know it's going to come because I'm a woman and men are retarded and they can't help but be disgusting creatures sometimes. No offense to the males, but seriously, I just want to go grocery shopping. Keep your eyes to yourself. Well, that kind of came out of nowhere. But I'm worried about the anger issue. I'm worried about getting attention afterwards, and like I did after I had my bariatric surgery, where I was just kind of like, I'm the same effing person. Why are you so nice to me now? Why couldn't you have been this nice to me before? Why couldn't you give me this attention before? I'm glad I'm over the attention phase now, but I am so worried about being angry that people are going to look at me with this more negative, I don't want to say negative, I don't know what I'm trying to say, with a more unpure motivation. I just worry about it because don't make me go off on you. Just don't. Like, I want to be a more peaceful, loving, calm person. I don't want to have to go off on you, but I will. And I don't care if I do it in public, or I don't care if I don't know you. I don't care if I've known you for 20 years. I will go off on you if I feel disrespected, or I feel like you're treating me a certain way for impure reasons, or whatever. For stupid reasons, for ignorant reasons, whatever. I will go off on you. So I am a little bit sad, and I want to see, what they're taking off of me. Just like, I don't know, like to say goodbye, I guess. I don't know. It's weird. It's really weird. Anyway, so that's it. So I'm kind of sad about to see it go. I'm kind of fearful of how I'm going to react to myself. I'm fearful of the reaction I'm going to get from other people. But at the same time, I'm excited about having a body that I'm proud of and that I can feel comfortable in. I don't feel comfortable in this body. Even when I look at pre-op, even when I look at pre-op pictures, I can now see the difference, and I did not know that I was that big, but I can still see the difference now. But even coming on this video, I'm like, oh, my face is so much rounder than it was in past videos, and I sat here and looked at myself in the camera for like 3 minutes before I actually pressed play because I don't see myself like this. So I obviously still have some body dysphoric issues. But I don't know. I have to work on the inside stuff, which when you watch Patrick's video and you watch Kelly's video below, I'm going to watch them over and over again until I get it, because I got to change a lot of stuff, and not just the outside. Because I'm 36 and this is ridiculous. I shouldn't care what you think so much, because you probably don't care what I think about you, so why should I care about what you think of me? I don't know. Anyway, 38 minutes later, I'm probably going to shut the F up. Thank you for watching. I apologize for being so long. If you have questions, please leave. I don't know how you could possibly have a question, but if you have a question, feel free to ask. Find me on Facebook. I'm Siva418. It's SIVA418, just like I am on here. I've had people find me on Facebook from watching my videos. I don't know. Thank you for watching. Thank you for all the new ads. Thank you for subscribing. Thank you, blah, blah, blah. I still have so much more to say, and I'm not going to say it. I'll talk to you guys all later. Hopefully, fingers crossed, pray for me, whatever you do, good wishes, good karma, whatever, that I make it through surgery okay. I'll be okay. I will talk to you guys later. Thank you. Bye.